Hi, so my name is Lanlalin Sojikul, and today I'll be presenting the anatomy of leg and foot. So let's move on to the bony structures of leg. So in the picture here is the anterior and posterior view of the tibia and fibula. So now this is the medial condyle of tibia and the lateral condyle of tibia. This is the shaft of the tibia and the anterior border. As you can see, this is the shaft, again, the medial border, and move on to the soleal line of the tibia. Also, you can see the medial malleolus. This is the head of the fibula, and you can see the shaft of the fibula. This is the malleolar fossa of the fibula. This is the lateral malleolus of fibula. As you can see, this is the interosseous border of the fibula. So this is the tibialis anterior. The origin is at the lateral condyle of superior half of lateral surface of tibia and the interosseous membrane. Insertion is at the base of the first metatarsal and the medial and inferior surface of medial cuneiform. Intervention is deep femoral nerve, and the action is dorsiflex and invert the foot. We can see the extensor hallucis longus, and it is originated at the middle part of the anterior surface of fibula and the interosseous membrane. It inserted at the dorsal aspect of the base of distal phalanx of the great toe. It is innervated by the deep fibular nerve, and its action is to extend the great toe and also dorsiflex the foot. This is the extensor digitorum longus, and it originated at the lateral condyle of tibia and superior 3/4 of the anterior surface of interosseous membrane, and it inserted at the extensor expansion to the distal phalanges of lateral 4 digits. It is innervated by a deep fibular nerve, and its action is to extend lateral 4 digits and to dorsiflex the foot. So this is the fibularis tertius. It originated at the inferior third of the anterior surface of the fibula and also the interosseous membrane. It inserted at the dorsum of the base of the fifth metatarsal, as you can see. The innervation is the deep fibular nerve, and the action is to dorsiflex and invert the foot. This is the fibularis brevis. It originated at the inferior two-thirds of the fibula and inserted at the fibulosity of the fifth metatarsal bone. The innervation is superficial fibular nerve, and its action is to invert foot and plantar flexus the ankle. This is the fibularis longus. It originated at the head of the superior two-thirds of the lateral surface of fibula and inserted at the base of the first metatarsal bone and the medial cuneiform. The innervation is superficial fibular nerve, and its action is to invert foot and plantar flexus the ankle. This is the gastrocnemius. For the lateral surface, it originated at the superior to the lateral condyle femur, and for the medial surface, it is originated at the superior to medial condyle femur. The insertion is at the posterior surface of calcaneus bone. The innervation is tibial nerve, and the action is to raise heel during walking, plantar flexus the ankle, and flex leg at the knee joint. This is the soleus muscle. It originated at the posterior surface of fibula, soleal line and medial third of tibia, and the tendinous arch. The insertion is at the posterior surface of calcaneus bone. The innervation is tibial nerve, and the action is to plantar flexus the ankle and flex leg at the knee joint. So as you can see, this is the plantaris muscle. It's originated at the lateral supracondylar line of femur and inserted at the posterior surface of calcaneus bone. The innervation is tibial nerve, and the action is to assist gastrocnemius in plantar flexing the ankle. So this is the popliteus muscle. It's originated at the lateral condyle femur and the lateral meniscus. The insertion is at the posterior surface of tibia superior to the soleal line, and the innervation is the tibial nerve. The action is to weakly flexus knee, unlocking the leg by rotating femur and medially rotate the tibia. The tibialis posterior is originated at the interosseous membrane, posterior surface of fibula, and the posterior surface of tibia inferior to the soleal line. The insertion is at the navicular, cuneiform, cuboid, and the 2 to 4th base of the metatarsal. The innervation is tibial nerve, and the action is to invert the foot and plantar flexus the foot. This is the flexor hallucis longus. It's originated at the two-thirds of posterior surface of tibia and the interosseous membrane. It inserted at the base of the distal phalanges of the great toe. The innervation is tibial nerve, and the action is to flex the great toe and plantar flexus the foot. This is the flexor digitorum longus. It's originated at the posterior surface of tibia, inserted at the distal phalanges of the lateral four toes. The innervation is tibial nerve, and the action is to plantar flexus the foot and flexus the 2 to 5th toes. Now let's move on to the bone of the feet or the foot. There are 3 groups of bone in the foot. First is the seventh tarsal bone, the proximal group talus calcaneus, the intermediate group navicular, the distal group which is cuboid and 3 cuneiforms. Second, the 5 metatarsal, which is the first to the 5th metatarsal. And third, the 5 phalanges bone of the toe, which is each toe has 3 phalanges, proximal, middle, and distal. However, except the great toe that has only 2 phalanges, which is proximal and distal. So the tarsal tunnel is formed on the medial side of the foot in a groove between the medial malleolus and the heel, or the calcaneal tuberosity, and by overlying flexor retinaculum. The structure that passes through the tarsal tunnel, including the anterior to posterior order, the tibialis posterior, the flexor digitorum longus, the posterior tibial artery, tibial nerve, and the flexor hallucis longus.
So this is the flexor digitorum brevis. It originated at the medial process of the calcaneal tuberosity, plantar aponeurosis, and intermuscular septa. It inserted at the lateral surface of medial phalanges of digit 2 to 5th, and the innervation is medial plantar nerve, and the action is to flex digit 2 to 5. So this is the abductor digiti minimi. It originated at the medial process of the calcaneal tuberosity, the plantar aponeurosis, and the intermuscular septa. It inserted at the proximal phalanges of the 5th digit. The innervation is lateral plantar nerve, and the action is to abduct and flex the 5th digit. This is abductor hallucis. The origin is at the flexor retinaculum, the medial process of calcaneal tuberosity, and the plantar aponeurosis. The insertion is at the medial side of the base of the proximal phalanges of the first digit. The innervation is medial plantar nerve, and the action is to abduct and flexion of the digit 1. This is the quadratus plantaris. It originated at the medial and lateral of calcaneus. The insertion is at the tendon of flexor digitorum longus. The innervation is lateral plantar nerve, and the action is to flex the digits. Work with the flexor digitorum longus to push the toes downwards. This is the lumbrical. It originated at the tendons of the flexor digitorum longus, inserted at the proximal phalanges of 2 to 4th. The innervation is the first lumbrical by medial plantar nerve, and second, third, and fourth lumbricals by lateral plantar nerve. The action is to flex the metatarsophalangeal joints and extend the proximal interphalangeal joints. This is flexor digiti minimi brevis. It originated at the base of the 5th metatarsal bone and the shed of the fibularis longus. The insertion is at the first phalanges of the 5th toe. The innervation is lateral plantar nerve, and the action is to flex the metatarsophalangeal joints. This is the flexor hallucis brevis. It originated at the cuboid and cuneiform bone. The insertion is the proximal phalanges of the first digits. The innervation is medial plantar nerve, and the action is to flex the metatarsophalangeal joints and to flex the first digits. This is the adductor hallucis. The transverse head originated at the plantar metatarsophalangeal of the 3rd, 4th, and 5th digit joints, but the oblique head is at the 2nd, 3rd, and 4th metatarsal. The insertion is at the base of the proximal phalanges of the first digit. The innervation is the lateral plantar nerve, and the action is to adduct digit 1, or the first digit. This is the dorsal interosseous. They originated at the adjacent side of the 2 metatarsal bone. The insertion is at the base of the proximal phalanges of the digit 2 to 4, and into the aponeurosis of the tendons of extensor digitorum longus. The innervation is at the lateral plantar nerve, and the action is to flex the metatarsophalangeal joints of digit 2 to 4, and to extend the proximal interphalangeal and distal interphalangeal joints. This is the plantar interosseous. It originated at the base and medial side of the metatarsal of digit 3 to 5. The insertion is at the base of the proximal phalanges of digit 3 to 5, and the innervation is lateral plantar nerve, and the action is to adduct the digit 3 to 5, the flexion of metatarsophalangeal joints of digit 3 to 5, and extension of the proximal interphalangeal and distal interphalangeal joints. This is the extensor digitorum brevis. It originated at the dorsal and lateral surface of the calcaneus. The insertion is at the lateral side of the extensor digitorum longus tendon digit 2 to 4. The innervation is the fibular nerve, and the action is to extend digit 2 to 4. This is extensor hallucis brevis. It originated at the dorsal portion of the calcaneus. The insertion is at the dorsal surface of the base of the proximal phalange of digit 1. The innervation is the fibular nerve, and the action is to extend the digit 1.
So this is the artery of the legs and the feet. Starting with the anterior view, the popliteal artery branches into anterior tibial artery, supplying the anterior compartment of the leg. Then the anterior tibial artery changes its name to dorsalis pedis artery and branches further into the metatarsal and lateral tarsal artery. So, however, at the posterior view, you'll see that the popliteal artery branches into the femoral artery, which supplies the lateral compartment of the leg, and into the posterior tibial artery, which supplies the posterior compartment of the leg. Then the posterior tibial artery branches into medial plantar and lateral plantar artery to supply the muscle of the feet. Now, if we look at the nerves of the lower limbs, you see that the sciatic nerve branches into the tibial nerve and the common peroneal nerve. So the tibial nerve innervates the posterior compartment of the leg and branches into medial and lateral plantar nerve, which innervates the muscle which I already mentioned in the first section. Now, let's look into the common peroneal nerve. It is branched into the deep peroneal nerve, which innervates the anterior compartment of the leg and the muscle of the foot, and into the superficial peroneal nerve, which innervates the lateral compartment of the leg.